In this video, we are going to talk about ovarian cyst. Ovarian cyst, because it is the most common cause of menstrual pain. So, an ovarian cyst is a sac filled with fluid or a semi-fluid material that forms on or within one or both of the ovaries. So, your ovaries are small organ in your pelvis that hold egg cell and make hormones such as estrogen and progesterone. So there are different types of ovarian cysts, most of which are painless and harmless, and they're called benign. And usually ovarian cysts don't cause symptoms. You likely won't know if you have anyone unless your provider find one during a routine pelvic exam or imaging procedure. So rarely ovarian cyst can cause complication. Scheduling regular pelvic exam and speaking with your provider or healthcare provider or your gynecologist can provide more about the symptoms and about the ovarian cyst so that you know. So let's talk about the types of ovarian cysts. Most ovarian cysts are functional cysts. They form in response to your body's changes during the menstrual cycle. So less commonly, ovarian cysts form for reasons unrelated to menstruation. So functional ovarian cysts are the most common type of ovarian cyst and are not disease related. They occur as a result of ovulation, and these cysts can be a sign that your ovary are functioning well as they should. So functional ovarian cysts generally shrink over time, usually within 30 days without specific treatment. We also have follicular ovarian cysts. A small sac in your ovary called follicle release an egg each month as part of your menstrual cycle. Follicular cysts form when the follicle doesn't release an egg. Instead, the follicle fills with the fluid and grow bigger. We have the corpus luteum cyst. After the follicle releases an egg, it forms an hormone producing group of cells called the corpus luteum. A cyst forms when fluid collects in the corpus luteum and causing it to grow. Sometimes functional cysts are called simple cysts. We can say that not all ovarian cysts form in response of menstrual cycle. They are not usually signs of disease, but the provider may want to monitor them to ensure they don't cause any complication in future. So these may include cystadomonas. I don't know how to pronounce it anyway. Cystadenomans. These cysts form on the surface of your ovary. They can be filled with fluid that is thin and watery or thicker and mucus-like. We have dermoid cyst. Dermoid cysts consist of cells that make up all types of tissues in the human body, ranging from skin, hair, teeth, or even brain tissues. We have endometriomas. These cysts are filled with endometrial tissues and the same tissue that you bleed each month during menstrual period. We have ovarian cancer. I don't like to talk about it. Unlike the condition above, ovarian cancer or tumor are solid mass of the cancer cell, and you know what cancer is. So, who is affected by ovarian cyst? Anyone who carries an ovary can be affected with ovarian cyst, but chances increase based on your age, pregnancy status, history of ovarian cyst, current medication. Let's talk about the age. Why someone might be at risk of getting ovarian cyst or most likely to be affected with ovarian cyst. Age. Ovarian cysts are more common in you if you haven't gone through menopause. So long as you are within the reproductive age, you're at most you are likely to get ovarian cyst. We have pregnancy status. Cysts are more likely to form and remain during pregnancy. So if you're within age of getting pregnant, you can also get ovarian cyst. We have history of ovarian cyst. If your family or one member of your family has ever suffered from ovarian cyst, you are likely to suffer the same. Current condition, current medical condition, you are more likely to get an ovarian cyst if you have endometriosis, hormone problem, or if you are taking medication to help you with ovulation, you are likely also to get an cyst. So ovarian cysts are extremely common, especially if you haven't gone through menopause yet. And functional cysts are most common type of ovarian cysts that we have said. Also, let's talk about the signs and symptoms, or signs and symptoms plus the causes. So what causes an ovarian cyst? Ovarian cyst is the leading cause of ovulation, not ovarian cyst. Ovulation is the leading cause of ovarian cyst. Other causes include abnormal cell reproduction. We have endometriosis. Those who are suffering from endometriosis can also develop ovarian cyst. We have PID in diseases, or pelvic inflammatory diseases, can also cause the ovarian cyst. So the signs and symptoms, we have the pelvic pain or dull arch in your back. We have a feeling of fullness, bloating located in your belly that may feel more pronounced on one side of the body. Also, we have pain during menstruation. Pain during menstruation, we also known as, it is called dysuria. Dyspareunia, not dysuria, but dyspareunia. We have also painful period. Yeah. Symptoms that linger could indicate a condition called polycystic ovarian syndrome. Polycystic ovarian syndrome is a condition that causes irregular period and other hormone-related problems, including obesity, infertility. Other symptoms of polycystic ovarian syndrome include increased hair growth on the body. What does it feel like when you have a cyst on your ovary? The experience of having an ovarian cyst vary from person to person. Some may have no pain at all. Some may have a mild discomfort or feeling of fullness. Pain that could be described as sharp or like dull pain. Also, a person may experience discomfort or pain that comes and goes without explanation. That one can also happen. Complication. What are the complications that might arise? The cancerous cyst, they can turn into cancer. I hope they don't turn. If you have, they can rupture. Yeah. They can cause ovarian torsion, where the ovary swell and then it's detangled, it rotates, and then yeah, that one, if they cause that one, you might need the surgery. About the diagnosis, how can the doctor realize that you have the cyst? Is through pelvic exam, ultrasound, laparoscopy. Yeah. Management of ovarian cyst is through the medication, hormonal medications. Some of them can be removed. Also, the treatment will depend on the factor like age, your symptoms, and what is likely to cause the cyst likely to cause. So functional ovarian cyst usually goes away without treatment. If your cyst is likely functional, your provider may suggest you wait and see if there can be complication, if they may develop any varying symptoms. You can control it with medication such as birth control pill to stop ovulation for for quite some time, and then you will stop. Then surgery, yeah, we have said surgery, they can be removed. So that is what I wanted to say about ovarian cyst. Sometimes they usually cause menstrual pain. Sometimes they don't. Bye, till next time.